So Ebola in the DRC is the third largest Ebola outbreak on record, and it is still climbing. It is still in the expansion stage. It's still a game of catch up where we're trying to contain this outbreak. The cases are now around 1,800 with over 600 deaths. The case fatality ratio around 34%. We know that this number is an undercount, that there are more cases out there because testing still lags, even though things are getting a little bit better. We have another American that's infected. This is an American humanitarian worker with Samaritan's Purse. Those of you who remember, Samaritan's Purse was also involved in the 2014-2016 Ebola outbreak in West Africa, and some of their personnel got infected, including Kent Brantley, who was a famous physician who was transferred to Emory. What is the fate of this American? Is this American going to go to Germany, which seems likely, like the last American that got infected? Or will they be allowed to use the Ebola treatment centers that we've built in the United States at taxpayer expense? I suspect this patient's going to end up in Germany. There is a fourth province in the DRC, Tishopo, that has cases. At least one of the cases there doesn't have a travel link to known cases in other parts of the outbreak zone, which tells you likely that there is a chain of transmission there, which we expect to find that's leading to cases in this fourth province. Healthcare workers have borne an inordinate burden. They're not only taking care of the patients, but they're getting infected. 112 healthcare workers have been infected, 32 dead. This is why it's so important that personal protective equipment is used when taking care of Ebola patients, that there are places to take care of these patients safely. And healthcare workers are kind of a canary in the coal mine that things are going wrong, that they don't have the resources they need. And not unrelated, there is a healthcare worker strike that's threatening recent progress and could stall the clinical trials that are going on to look at the monoclonal antibody, looking at remdesivir, looking at obeldesivir. All of that is up in the air if there's a strike going on. And there's a deeper failure here. This is an area that did have an Ebola outbreak between 2018 and 2020, the second biggest Ebola outbreak. But there doesn't seem to have been sustained risk communication. People's memory has kind of failed. They don't remember what happened there. And we're seeing the same resistance and the same misinformation recur. And remember, misinformation is the biggest ally of this outbreak, and it needs to be addressed. A couple of guardrails to keep in check here, or to make sure are intact. This is an area where malaria is also endemic. You don't want malaria services to collapse. During the 2014-2016 outbreak, it said that the malaria collapse caused as many deaths as Ebola. That was over 10,000. So I think it's really critical to make sure that you're not forgetting the other infectious disease problems that plague parts of the DRC. Ebola is not something that's going to go pandemic. It is very constrained in its ability to spread. The real worst case scenario here is that you've got kind of an area where it is sort of endemic, or there's like a frontier where Ebola abounds, where this is just where Ebola is common. That's what people are trying to avoid.